Hi everyone, my name's Jessie. I'd like to share a story with you from my freshman year. One day, my friend came to me and told me that he might have HIV. At the time, all I could do was be there to support him and encourage him to get the help that he needed. Even as a student at a large university, he encountered an abundance of information, the majority of which was not specific to his situation or action-oriented. Frustratingly, his story is shared by hundreds of thousands of college students every year. The reality is that college students are not the healthiest population. Even before COVID-19, 65% of college students reported being in poor health. So, if a college student is in poor health, where do they turn? Well, a common option is online, but even then, 90% of college students reported having difficulty finding health-related information in a digital format. That's where Chat Health comes in. Chat Health is a nonprofit that's providing accurate, real-time, and understandable health information to college students through engaging technology. In March 2020, we launched our first COVID-19 chatbot platform. On this platform, a user could simply text our chatbot and receive tailored answers to student health questions. From this initial launch, within our first 6 months, we were able to reach 4,000 UMD community members. This fall, we partnered with the Health Center and the Student Health Advisory Committee to expand our reach to over 40,000 UMD community members. Energized by our success in Maryland, we are excited to expand our impact through a sustainable, chapter-based model. Specifically, with our Chat Health mobile app, we are able to support chapters as they curate university-specific health information to improve health literacy on their campuses. Users just tell Chat Health their name, their age, their gender, and their university. From there, we can create a personalized dashboard with health information and resources. Then, a user can enter our chatbot and ask questions about student health on campus. To spur this initial growth, we plan on partnering with other Maryland campuses, such as UMBC and Howard. As well, we're planning on working with East Coast campuses like Rutgers. From a sustainability point of view, this will allow us to reach 100,000 students in this year alone.
After customer discovery with campus administrators, we plan to charge universities a base rate of $750 per semester, specifically allowing us to avoid university procurement. Each university chapter will also fundraise and apply for grants offered by their specific institution, providing them with $250 per semester to promote Chat Health among their peers. We also project semester-based costs for app maintenance to be about $200 per semester, and this difference between our costs and our revenues will be directly reinvested to support our Chat Health staff, to improve our technology, and to fuel our growth. Specifically, we are targeting the 500 universities across the US with greater than 10,000 students each, providing us with an annual serviceable obtainable market of $1 million. Chat Health is committed to ensuring that no student ever has to pay for our technology, and this mixed revenue model directly allows us to realize this goal and ensures that our technology is accessible to students from all backgrounds. Being awarded $5,000 will provide us with an unparalleled opportunity to scale Chat Health nationally. We will spend $1,500 on starting our first 5 chapters and $3,500 on the development and beta testing of our Chat Health mobile app. It'll also allow us to develop the organizational and technical infrastructure to reach millions more over the next 5 years, building upon our initial successes and social impacts right here in Maryland. Our team is ready to change how students access health information. And with just a few $1,000s, we have developed and implemented technology that has reached thousands of our peers and engaged dozens of passionate student volunteers. But now imagine what we could do with $5,000. Imagine if Jesse's friend could have simply texted the Chat Health chatbot, and had relevant and actionable information right at his fingertips. We invite you to join us on our journey of improving student health, both during this pandemic and beyond. Thank you so much.
My question for you is, how have you thought about the pitch that you're going to be making to other institutions? Because if I understand the model correctly, the institutions are bearing the most of the cost for this model. And so have you thought about that pitch? What is it? And how do you know from your research that there's a market that institutions will actually want to pay this fee?
So I really appreciate your question as well. So one of the first things that we did when we were thinking out this model is to go speak to as many faculty members and campus administrators as we could and work with health center and health promotion staff. We started right here in Maryland, and then we expanded to other universities that would be willing to talk to us. And we found one thing that was the really key theme, is that if it's something that's led by students, something that integrates students, and something that is able to capture the essence of how student health is accessed and delivered on a campus, that's where the true value addition is provided. One thing we realized is really unique is this whole bridge of public health and technology being able to come together. It's common on this campus, but it's not common in a lot of campuses. And us bringing our background in these two fields, being able to work with students, and then finally being able to work with the health center, having that kind of three-legged stool all working together provides us a really unique value addition to be able to go and charge a subscription-based fee, because we've developed the infrastructure and the partnerships to make it really easy for the health center to offer this in addition to other things that they're already offering for their students at the university.
I think what we've realized since initially releasing our SMS messaging platform is that ultimately we've done a great job at sort of presenting this information in a way that meets students where they are. For instance, we are always on our phones, for better or for worse. And with a messaging platform, students are able to quickly receive accurate, understandable, and comprehensive answers to their public health questions. This is just one example of the way in which our mobile application is actually building upon the success of our messaging platform and recognizing that students will want to access health information in diverse ways. And so we're tackling a variety of different root causes of health literacy through a mobile application and building upon the success that we've already had with our messaging platform.